Welcome to the Deep Dive. Today we're diving into something really fascinating, AI in healthcare.
Yeah, specifically how it's starting to fundamentally change diagnosis and treatment. It's moving fast.
Exactly. And our mission here is pretty straightforward. Cut through some of the buzz and really understand, based on the material we've looked at, how AI is genuinely reshaping medicine, like right now.
Okay.
So let's get into it.
Well, what jumps out immediately, I think, is how AI could help us get past some of the, traditional limits in healthcare. Our sources definitely point towards, well, more precise and proactive ways of doing things because of these technologies.
Absolutely. So let's kick off with diagnosis. The info we have really highlights AI's, pretty incredible ability to analyze medical images.
Right.
Think about X-rays, CT scans, MRIs, AI algorithms trained on just massive data sets can sometimes spot things faster, maybe even more accurately in certain cases than the human eye.
It's almost like having this superpowered assistant that just doesn't get tired or distracted, These algorithms can pick up on these tiny patterns in the images, patterns linked to specific diseases, sometimes way earlier than we could before.
And that early detection, as the source material points out, that can make a huge difference in patient outcomes.
A massive difference.
And it's not only about images, is it? The material also talks about AI crunching all sorts of patient data, lab results, genetics, medical history.
Right, looking for connections, maybe subtle links that a person might not spot easily.
Exactly. And that's where it gets really interesting, I think. Imagine AI flagging potential risks or figuring out the root cause of something complex by connecting dots that seem, unrelated at first glance.
Yeah, it's synthesizing this vast amount of information, kind of like a medical detective work, but supercharged, leading to much more informed diagnoses.
Okay, so that's diagnosis. What about treatment? How's AI shaking things up there?
The sources talk a lot about more tailored approaches. This is where that idea of personalized medicine really starts to feel real. AI can look at your specific biology, your medical history, maybe even your lifestyle data, and predict how specifically you, might respond to different drugs or therapies.
So optimizing the plan for the individual.
Exactly. Boosting effectiveness, maybe cutting down on side effects. That's the potential highlighted in the information we looked at.
And robotic surgery gets a mention too. Sounds very sci-fi, but it's actually here.
It is. AI-powered robots are assisting surgeons, allowing for incredible precision, especially in those minimally invasive procedures.
Which could mean what? Smaller scars, quicker recovery? That sounds like a win for patients.
Definitely. Better precision, potentially fewer complications. That's what the material suggests. More accuracy, better outcomes.
So beyond fixing problems, the sources also touch on AI just making the whole patient experience better and more supportive, like day-to-day health management.
Yeah, this is quite interesting. Think about AI virtual assistants or chatbots.
Yeah.
Imagine having something on your phone that can answer basic medical questions reliably, give you medication reminders, maybe even help monitor vital signs remotely.
That kind of personalized support could be huge, right? Empowering patients.
And improving access, too. Think about people in remote areas.
Telemedicine gets a boost here, I suppose.
For sure. AI can enhance telemedicine and remote monitoring, bringing expertise further afield and keeping a closer eye on patients between visits. Continuous insight, potentially.
Right, catching problems earlier. Okay, and the material also mentions AI optimizing the background processes, the hospital stuff.
Yeah, the sort of nuts and bolts. It might not sound as exciting, but it's really important for making the system work better.
How so?
Well, AI can analyze hospital operations data. Things like predicting patient flow, managing beds, allocating staff and equipment more efficiently.
So reducing wait times, maybe cutting costs, making things run smoother.
Exactly. A better experience for patients and staff, hopefully. It's about optimizing the whole system.
So when you piece it all together, the picture we get from these sources is clear. AI isn't some far-off future thing in medicine. It's here, now, and it's already making tangible changes.
Absolutely. It's reshaping how we diagnose, how we treat, even hinting at speeding up things like drug discovery down the road.
The transformation is definitely underway.
It really is, affecting almost every step of the healthcare journey.
Okay, so the key takeaway seems to be that AI is fundamentally altering the landscape of diagnosis and treatment today, not tomorrow.
Which leads us to a final thought for you, the listener, to maybe ponder. Considering how quickly all this is advancing, what do you think are the biggest, maybe ethical hurdles we really need to grapple with as AI becomes even more deeply woven into our healthcare?